A very good evening, dear participants. We are on the fifth day of our faculty development program. So, the first session of this day will be handled by Dr. P.K. Ramakrishnan. He is the professor and head in the Department of Anatomy, P.K. Das Institute of Medical Sciences, Vaniyamkulam, Kerala. So, to begin with the session, I would like to give a brief introduction about our resource person. So, he's been working at PK DIMS since the inception of PK DIMS from the year 2013, and he's also holding the post of Phase 1 Academic Coordinator and Curriculum Committee member at PK DIMS. He obtained his MBBS from Government Medical College, Thrissur, MD in the area of anatomy with gold medal for best outgoing student from Annamalai University, Chidambaram. He's teaching in the area of anatomy at UG and PG levels from the year 1997. Accredited PhD guide for various universities including KUHS, Annamalai and Dr. MGR Medical University. He has also acted as a reviewer for many textbooks in anatomy. He has around 28 publications in various national and international journals, including PUBMED. With this brief introduction, I would like to extend a very warm welcome to Dr. Ramakrishnan on behalf of the Department of Electronics and Communication Engineering of Nehru College of Engineering and Research Center. Welcome, sir. You may please start the session. Thank you.
Good evening. Am I audible?
Yes, sir. You're audible.
Yes. Okay. So, once again, good evening to one and all. So, I wish to express my sincere thanks to Dr. Mrutil and Dr. Kirtana of the Department of Electronics and Communication Engineering, Nehru College of Engineering and Research Center, Pambadi. It's our sister institution, actually. So, I'm very delighted that you have invited me to share this guest lecture for you as a part of the faculty development program. My niece, I think Jayalakshmi had done her MTech from your college just a few years back. I think now she is working at Sahardaya Engineering College. Okay, maybe so. And I have visited your institution right from the beginning, actually. So once again, thank you very much. So I also take this opportunity to thank our esteemed chairman and the managing trustee of Nehru Group of Institutions, Advocate Dr. P. Krishnadas sir. And also, I'd like to thank our own Director of Operations of PK Das Medical Sciences, Dr. R.C. Krishnamurthy sir, and my principal, Dr. Sadesh G. Prabhu sir, for giving me an opportunity and to address you all in this very important session and this very beautiful evening. Okay, I've got one more very important online meeting related to the university at about 7:15. So I may be not able to continue. Maybe I am just planning to continue for about 1 hour. If it's okay with you, definitely. And within that time, actually, just I will to briefly cover up the topics assigned to me. Okay. And probably just I'll finish about 5 to 10 minutes earlier. So after that, we'll have an open discussion, definitely. Okay, because I may be dealing with a very difficult topic. Okay, so we can have any discussions. I think we can have towards the end of the sessions, definitely. And please let me know if anything any flaws in my audio or something like that in the video, something like that. You can just let me know immediately. I will do the corrections from my side. So I hope you may have visited PK Das Institute of Medical Sciences. If you have not done so, if I invite to make a visit to our institute, which is almost 1,500 bedded super specialty hospital and a medical college, now catering to about 200 MBBS students, and we are planning to increase our intake of MBBS students into 250 right from this academic year onwards. And this is one of the highly accredited and one of the best institutions at par with the government medical colleges in the state. So actually, it's a rather complicated topic that has been assigned to me today evening. So before that, can I know who's the audience? Actually, is the faculty of your department or the college? Were actually the audience? Kirtan or somebody.
Sir, from many different areas. Yes, sir, many different. Sir, almost North India, faculties, mostly faculties and research scholars are there. So
Oh,
only
sure, definitely.
20%. Yeah, okay, fine.
Okay, so mainly I will be addressing the faculties and the faculty members from the various institutions and also
Yeah.
the research scholars.
Yes, it's
So
only
so okay.
faculty members.
So very good. I would
Yes,
just like to
please.
get an idea about the audience because okay, you have given a very difficult topic today. Actually, that's introduction to
Okay,
human
sir.
anatomy and medical imaging. So I will try my level best actually. Single like but okay. Of course, being a core anatomist, right, for the last 25 years, definitely. I will try to take the anatomy session as far interesting as possible. I'm not an expert at medical imaging, of course, but definitely I will try my best with the second session of this program, that's medical imaging. Just a brief. I think you will be familiar with the medical imaging. I think many of you, I think, maybe more familiar with the technical and the physics and the chemistry and the electronics of the medical imaging techniques. But I will be just giving some basic idea regarding the medical aspects of the various imaging procedures, especially from a medical point of view, definitely. Okay. So I'm going to take this session. The first half, I will be just going through the brief anatomy. Of course, as you know, anatomy is a very extensive subject. It's one of the extensive subjects that the medical students will be studying in the first year. Is almost about nearly 500 hours spread out in 2 semesters, actually. So it is very difficult to condense the entire anatomy into a short session like that. But definitely, I will just try to highlight the most important aspect that will be useful for those attending in this session, actually. So, so in between, okay, many of okay, maybe I may be very sorry that I may be because I'm used to some interactive teaching actually. So I may be just asking some questions or something like that in between. Definitely. So if you are, you can just feel free to answer the questions if you wish to. Definitely, you can just unmute and just answer. So it will be a great motivation for me, definitely, as I got into my go ahead with my presentation, definitely. So can anybody tell, we'll just start with the basic idea. What is anatomy?
So knowing the internal parts of a body, sir.
Yes, okay, very good. Okay, so that's actually because, thank you very much. Okay, so it's not only the internal structure, but it's also knowing the external structure. So anatomy means to study. It's a study that deals with the structure of the human body, whether it is at the gross level, that is means at the visible level, or it can be even up to the microscopic or the genetic levels that we'll see in the subsequent slides actually. So usually the term is actually it's a Greek term. Okay. Tomi means, as we know, tomi means something related to cutting or something like that. The thing like it. So usually okay, the previous days, even now, I think we study the structure of the human body by cutting, by cutting the cadavers or the dead bodies or something like that. Definitely. So we study the anatomy. Okay, definitely from that viewpoint. That's why it's called it's a study of the gross structure, not the entire structure of the body, right from the gross to the microscopic levels and the submicroscopic levels, all encompassed in the anatomy. There are several subdivisions of anatomy that we'll go into detail later. Okay. Now, again, very sorry to asking you a second question. Why do you want to study anatomy, especially many of the medical students? Of course, it's a mandatory for all the medical students, and even for the many of the paramedical courses like nursing, pharmacy, everything. I think almost their first subject they have to clear is anatomy before they go further. Actually, okay. So what is the purpose to study anatomy as far as medicine is concerned? Can anybody answer this question? Why you should study the structure of the human body, especially I'm just asking about from a medical point of view.
In order to know the function of each parts of a body, sir. In
Yes,
which
very
way?
good. Okay. Oh, you can continue, please. Okay.
In which way it absorbs the water, or how it secretes the secretions.
Okay, okay, very good. That's a very good answer. Just I really appreciate your answer actually. But that is what you said actually. That is related to another aspects of basic anatomy that we usually in medical terms we call it as the physiology. Physiology deals with the function of the human body. Function just because both the students, the first year students, probably they study both these simultaneously, side by side. Actually, anatomy deals with the structure and physiology deals with the function. For understanding of the physiology, the functioning of the normal body, as you rightly said, you should have a clear-cut idea regarding the normal structure of the human body. That's very only if you know the structure, definitely you should be able to know the function and the other aspects related to the function. And one more importance I will tell you regarding anatomy is that, of course, when you might have visited a hospital with a patient or something like that. You might have undergone some investigations, something like that. So that means something is abnormal, something not normal. Actually, is okay. Something outside normal. Okay. So that's why you go to a hospital or visit a doctor or something like that. So this abnormality, or what you call that, it's maybe related either to the structure or to the function, actually. So it may be related to the anatomically. So before we can examine a patient, when a doctor examine a patient with a disease, actually, they should have an idea regarding the normal anatomy, because most of the patients will be presenting with some abnormalities in the affecting the organs or the tissues or whatever may be. I'm not going to the details at this stage, definitely. So before we go, what is abnormal with a particular organ or for example, of a heart or kidney or something like that, you should have a idea, or you should have a foundation of what is a normal structure as well as function. As I told, the function is also important, because many patients will be presenting with the functional abnormalities, definitely. So you should also know the function as well as the structure. Then only you will be able to, when you're seeing something abnormal, you will be able to, you can correlate. So what is, you can correlate what is the deviation from the normal, or we say what is the deviation from the normal, and go for the treatment purpose or something like that. So I think that's why anatomy and physiology, both anatomy and physiology, form the basis of medicine and all clinical and paramedical subjects, actually. So you should have a thorough foundation of both these subjects, actually. So that's also important. Okay. I think that you might have studied actually in the very early classes or something like that. The human body, the organization of the human body. So start from the smallest stage, you can have to be the atoms, the molecules. Then you have got the cells. Okay, I'm not going to the details of each and every. Okay, the cells are there. Then okay, cells, the different cells form the different tissues, actually. Okay, the tissues join together to form the different organs, and the organ systems, they are going to take part in the organ systems. So there's a specific hierarchical organization of the different structures in the human body, right? Like you see in a circuit or something like that, in a engineering marvel or something like that. Definitely the human body is also organized in a very structured manner, so that it is easy to examine or easy to study the human body, actually. Okay. So again, to repeat this, so we have got the for the cells, actually. The cells that perform for example, the cells will perform a common function or something like that. They will group to the tissues, actually. So in the human body, you have got 4 basic types of tissues. They perform a common functions like epithelial tissue, which forms the covering of the skin or something, protection, something like that. It also lines the inside of the various the body cavities, like the gastrointestinal tract and the respiratory tract, and they they're related to absorption or something like that, definitely. So epithelial tissue is there. Then you can see the muscle tissue. You might have already studied about the muscle tissue. The muscles are responsible for the body movements, actually. The muscles are again grouped into 3 types. You can see the skeletal muscle, which especially moves the bones, attached to the bones. The smooth muscles, which are not visible, actually. The smooth muscles are again present in the walls of the different the viscera or the different organ systems, which help in the internal movements like the peristaltic movement in the gastrointestinal tract, like that. And one more important muscle that you can see in the heart. It's a modification of both the skeletal muscle and the smooth muscle. That's a cardiac muscle, which is exclusively seen in the heart, actually. That is a very important to the critical functioning of the heart. So so muscular tissue is there. Then you have got the nervous tissue, is very important, which is present in the brain and the spinal cord. That forms the central nervous system and the peripheral nervous system. And that actually coordinates all the body activities are controlled by the nervous system. And the 4th type of tissue you can see is a connective tissue. There's a biggest amount of the tissue in the human body is organized by the connective tissue that bridges the gap between the different organs and the organ systems, like that. So, each of these tissues, they combine to form. The different tissues which perform a common function. They form an organ, for example, like the heart or the stomach or the liver or the lungs or the brain or something like that. And again, different organs that constitute a specific function. They constitute the organ system. For example, you can see can you name a few important organ systems which are seen in the human body? That important systems or something like that you may know. That means a group of organs doing a specific function. For example, you can see the gastrointestinal system, you can see the respiratory system, the reproductive system, endocrine system. There are so many systems in the body. Okay, so that's the basic organization of the human body actually. And now a little bit, how we are going to study anatomy? This is important because many of not that very familiar. Okay, of course, anatomy will be familiar, but those who are actually outside the medical field or something like that, definitely they may wonder how these medical students or somebody we are going to study anatomy actually. Okay, so we'll just briefly highlight up that. And usually again, there are two ways or two patterns of studying anatomy. One is what is called a systemic anatomy, and the second one is called as a regional anatomy. Systemic anatomy, as already mentioned, the body is composed of the system, the organ systems are there. And we usually take the system one by one actually, and study that all the structures, all the organs or all the tissues which are present in one particular system. For example, if we are taking the cardiovascular system, we'll be studying about the heart and all the blood vessels, the arteries, veins, and everything we'll be studying in the cardiovascular system. If you are going to the respiratory system, we'll be studying the lungs and the associated structures like that. So we go in a systematic manner. But in medical schools, what we usually do is what is called as a regional anatomy. That means a regional approach to the human body, because this is much more important when a doctor examines you in the hospitals. That is important because he is going to. Okay, of course, systemic anatomy is important, but of course, a patient presenting with some disease or conditions like that, especially the anatomy is examined in a region-wise manner, actually. So you should have some idea regarding the regional anatomy. So this picture just shows the human body divided into the various regions and the sub regions actually. So we'll just try to see what are the. So these are some of the important regions of the body. I think these are very not medical terms actually. These are very colloquial. They are very usually lay terms actually, which are used in the usual examination. So the human body can be divided to the head and the neck region. That's the most important part. As we know, the head contains the brain and the associated structures. And the neck is the narrow region just below the neck that contains all the important arteries and the nerves passing from the brain. Then the upper part of the body or middle part of the body is called as the trunk actually. The common name is given to the trunk. The trunk again can be divided into 2 or 3 subdivisions. The upper part of the trunk is called as the thorax. The upper part of the, okay, in lay terms, it is called as the chest or the chest cavity or something like that. But medical terms, it is called as the thorax. The thorax houses, as we know, the thorax houses the heart and the lungs. The thorax is very important because it contains the heart almost in the midline and the lungs on the either side actually, and in the pleural cavities or something like that. And then below the thorax, you can see the abdomen and the pelvis. The abdominal cavity actually. These are all actually cavities which are actually bounded by the anterior posterior walls actually and lined by the membranes. These are all the cavities which contain the specific the organs with their coverings and the associated structures are seen in these cavities. So you can see the abdominal cavity and the pelvic cavity because there is no strict demarcation between the abdomen and the pelvis. The abdominal cavity continues as the pelvic cavity. In the thorax, actually, there's a demarcation. There's one structure which is called the diaphragm that actually separates the thorax from the abdomen. I kindly request you to just keep your mobiles in an unmute. If I mute this thing, because it may be causing some slight disturbance. So you have the trunk is divided into the thorax, the abdomen, and the pelvis. As you know, the thorax I The thorax contains the lungs and the heart. The abdomen contains the major part of the gastrointestinal tract, including the various digestive organs like the stomach, the intestines, and the liver, pancreas. Everything is seen in the abdominal cavity. And the pelvic cavity mainly contains the kidneys and the reproductive organs. Okay, like that's a part of the trunk, and then you can see the limbs actually. You can get the two the upper limbs and the two lower limbs, the hands or whatever what do you call it, actually called as the limbs actually. Okay, so this is the basic regional organization of the human body actually. Just to show some pictures actually, I'm not going to the details. It shows the head and neck region actually. Suppose each region is composed of its own bones. The muscles will be the skin, right? Starting from the skin. So if we just incise open the skin, cut open the skin, we'll be able to see the muscles, the bones, and everything, the blood vessels and the nerves, everything will be there. So this is just an organization. Now, if we are going to study the head and neck region, okay, we are going to cut the skin open and make the skin open and study the various structures, the muscles and other structures, the blood vessels, nerves, which are seen inside actually in a region-wise manner actually. Okay. So this is just a picture of the, I hope the images are visible to all. This thing and like this is the picture of the upper limb actually. In medical terms, we call it as the upper limb. But of course, from an anatomical point of view, we divide the upper limb into several parts actually. So I'll just tell you that because that's a very commonly used terms actually. So we start from the shoulder, then we have got the arm, we have got the elbow, the forearm, and the hand. Because if you go to a doctor or something like that, the doctor may examine according to the regions actually. Okay. So it's important to know the different the subdivisions of the upper limb, something like. Similarly, in the lower limb, you will be able to see the other parts like the hip, the thigh, the knee region. Then below the knee, you can see the leg, then the ankle, and then the foot, etc. So these are some of the basic concepts regarding the regional anatomy. Because regional anatomy is important because the medical students are going to study anatomy based on the region-wise approach to the body. And again, a doctor examining a patient also uses the regional anatomy to simplify his examination process actually. Okay, how to study regional anatomy? As I already told, attention is focused on a specific part, a region or a sub-region. For example, as I told, the upper limb again can be divided into different parts like the arm, forearm, and the hand like that. And even subdivisions like major subdivisions like the forearm or the hand again can be divided into various subdivisions, like depending on the arrangement of the various structures and the arrangement and the relations of the various structures within a particular area are particularly noted actually. That's like it. Okay. There are several branches or several approaches to study anatomy, especially the regional anatomy. The approach that we commonly use in medical schools actually is what is called the gross anatomy. Gross means as it is visible to the naked eye actually. The examination of the structures of the human that can be seen without a microscope actually. That's a way called the external structure or the gross structure. Okay. Suppose I already told you that the doctors will be examining a patient in the hospital, but before that, you have to know what is the normal arrangement of the various structures or the various organs or the muscles like that. So the best method to study the gross anatomy is doing by the dissection. So that's why our students we have got the preserved the cadavers or the dead bodies which are available actually, and the students are actually doing an hands-on dissection on the cadavers in a region-wise manner. And in this way, I think they will be able to visualize almost all the structures of the cadaver. Okay, we use the preservative techniques for the cadavers. Of course, there will be some differences to the living human, I think, but I hope most of the structures they are. Of course, there may be a change in the color or the texture or something like that. Only that. Otherwise, almost all the normal anatomy is almost as written in the dead bodies also, the cadavers also. So once you dissect the cadaver, cut open the cadaver and dissect the cadaver, you will be able to see the same arrangement of the structures as you can see in a living human being. So that's why we use the the cadaveric dissection to study the gross anatomy, actually. So that's the most important part of our anatomy syllabus or the anatomy curriculum is related to the gross anatomy, and the maximum hours are attributed to given to the gross anatomy. I think per week, I think students will be, I think they will be doing almost 14 to 15 hours of dissection in our dissection lab, actually, under the guidance from the faculty members and the teachers. And it's also an integral part of their examination also, actually. Where previously we used to, the students had to do the cadaveric dissection for especially at the UG level, but I think now at the UG level, they don't have to do the dissection. Of course, PGs have to definitely go for a dissection, but the UGs have to discuss or demonstrate a dissected specimen or a limb, something like that. So that's a gross anatomy. There are some other approaches to study anatomy, which may be important from a medical point of view. One is called as the topographical anatomy. Topographical anatomy means, suppose if you are seeing a patient or a live person or something like that. It provides knowledge to what lies under the skin, actually. So if you just see the external features, you should be able to know which are the structures which are possible to touch or palpate or something like that, taking a pulsation or something like that. Something which is present, some specific landmarks or structures that are present beneath the skin, actually. So aim is to visualize this. Okay, so body or some prominent landmarks or bones, maybe some other bony parts may be prominent on some parts of the body, for example, like the hands or something like that. So that gives an idea to what structures are possible to touch or palpate in the living body, actually. For example, the most common example of a topographic anatomy, I think you're the pulsation. You can see the various use arteries for the various pulses, for example, like the radial artery at the wrist. Of course, you cannot see the radial artery because it is hidden by the skin and the muscles. But if you know the specific area of the radial arteries, definitely you can just palpate you can feel for the pulsation of the radial artery. So that's an example for a what is called as a topographical anatomy or the surface anatomy. This is mainly used for the feeling the pulsations. Okay. Then another important approach to study anatomy is called as a radiological anatomy. Of course, we are going to have a
Hello, sir. Hello, sir. Are you online?
Not audible, sir. Hello.
Ma'am, it's totally black.
Yes, sir. Yes, sir. I'll just find out what is the issue. Just a minute, sir, please. Nitinjo, sir, please mute your mic, sir. Nitinjo, sir, please mute your mic. Please mute your mic, sir. Dear participants, sorry for the inconvenience. There is a small technical issue with Ramakrishnan sir. He's just checking it out. I humbly request you to wait for a few minutes. I think you can share it once again, sir.
But the sharing option is not coming actually on the screen.
It will come, sir, because you have been made as the presenter, so you should
Okay, let me check.
you should be in a position to share it. Just check it out, sir.
Only meeting organizers and presenters can share. It's
Yes,
coming
you
like
are the presenter actually.
Is it coming now?
Yes, sir. Now your slide. Start. Yes. Yes, sir.
Oh, okay. From which slide?
There is an echo in your voice.
Hello, ma'am.
Ramakrishnan,
Echo
sir, I
from
think
now.
there is some echo. Just find out, sir, what is the issue?
Ji. Yes, ma'am. There is echo is coming.
It is there.
No, slides were visible, sir. Slides were visible.
But the echo is there.
Only issue is some echo. Echo issue is there. That's all. Apart from that, no
Please wait.
problem.
Please
is
wait.
there.
പിന്നെ ഭയങ്കര echo കിട്ടുന്നുണ്ട്. ഒന്ന് നോക്കൂ. ഭയങ്കര
But yes, sir. Your screen is visible now.
ഞാൻ മീറ്റിംഗിലാണ് കഴിഞ്ഞിട്ട് വിളിക്കുന്നത്. ഓ ശരി, പറഞ്ഞ കഴിഞ്ഞിട്ട് വിളിക്കാം കേട്ടോ. അപ്പോൾ വിളിക്കാം. ഓ ശരി ശരി.
So screen is visible, sir.
Okay, is my screen visible?
So your screen is visible.
Am I audible?
Is audible, sir? You can continue, sir.
Yeah. Okay, sure. Sorry for the some technical thing. Okay.
Okay, sir.
I think you have seen this slide actually. Now is it clear? Because I think
Yes, sir. Yes, sir.
yes,
It's
sir.
all clear.
Because I am sitting at the college alone, and my IT person is actually coordinating. It's from another area site actually. So that's the issue. So I don't have because they are actually busy actually. So I think that's okay. Please let me know in case of anything. Don't worry. Okay. So we are just okay. I think okay. X-rays. I think radiological imaging will come to it later stage. So one aspect of anatomy, we already told you the histology or the microscopic anatomy. So why do you study the microscopic anatomy? Because again, when you go further into examination of a patient or functioning of the pathological base of a disease, you should study the abnormal tissue, for example, a cancerous tissue, for example. One of the first and foremost things is to have a pathological examination of a tissue. So again, in order to know what is abnormal or what is pathological in a tissue, you should be able to tell what is the normal microscopic structure of a particular tissue or an organ. Then only you may be able to identify what is abnormal. So again, microscopic anatomy is a prerequisite for studying the abnormal tissue pathology also. So that's one of the components of the microscopic anatomy. Okay. There are several microscopic techniques, like I'm again not going to the details, like light microscopy, which you routinely use in our labs or something like that. Then there are others like the scanning electron microscopy and the transmission electron microscopy to get a more ultrastructural details of the cells and the tissues. Okay, actually. Okay, these are all I think very common. The light microscopy, usually they magnify up to 10 into 1,000 times actually. The scanning electron microscopes, which are mainly used for doctoral or PhD students or like that, they can magnify out to almost about 5 lakh times, and you can able to get a 3D image of the sample surface, especially the scanning. You get a scanning image of that particular surface of a particular organ or a tissue, something like that. And if you want to know get a high resolution image from a very ultra thin sample, you can go for a transmission electron microscope actually. Okay. These are not very routinely that used actually. Okay. And okay, I told you, okay, somebody told in the beginning of the session that, okay, something that should be something abnormal, need not be related to the structure or the function or something like that body. It can be even related to your genes, your chromosomes or something like that. So again, we have got a branch of anatomy that is called as the genetics. It's not a branch of anatomy, so it's a branch of medicine actually. The genetics is we'll study the DNA right from the DNA, the chromosomes, and the structure of the chromosomes and the branch of the chromosomes, genes and everything, something like that. So it all comes under the genetics. So a patient or a disease, even it may not be related to the structure or the function, or it may be obvious. It may be either related to the molecular levels or the submolecular levels like the DNA or the genes. So the study of the genetics is also going to be very, very important. This I have told you the various. So this is how the main approaches or the various avenues for studying the anatomy as we are concerned actually. And as it is already been told you, the physiological system. Most of the other students, other than the usually the medicine, actually they study the human body in the various system wise actually. Okay. So for example, I'm just showing a few systems. For example, like the cardiovascular system, I think. Especially, again, a doctor studies the cardiovascular system like a cardiologist, or a doctor goes to the diseases affecting the cardiovascular system. So you will be studying mainly about the heart and the blood vessels. As you know, the heart is the main pumping station from there, and you have got the various blood vessels that either take the blood away from the heart or to the blood towards the heart. The blood vessels that take the blood to the heart, the impure blood, they are called as the veins, and the arteries, they take up the the blood to the various tissues of the body, and they are connected by the capillaries in the various which are present in the various tissues. So the cardiovascular system encompasses the heart and the various blood vessels and the associated structures, and also you might have heard about the lymphatic system. Actually, it's a part of the cardiovascular system. It's an ultrafiltrate of blood which is called the lymph that is carried especially in some parts. Okay. You might study the respiratory system, which mainly is concerned with the breathing or the respiration. That mainly involves the trachea. Trachea means the windpipe and the two lungs actually. So that forms a part of the respiratory system. Okay. The digestive system includes right from the mouth actually. Starts from the mouth, then going down you have got the pharynx. Then you have got the esophagus, which transmits the food from the mouth or from the pharynx right to your stomach. And the various parts of the gastrointestinal system or the intestines, which are mainly present in the abdominal and the pelvic cavities. So right from the stomach, you have got the small intestine, which composes of the duodenum, jejunum, and the ileum, and the colon or the large intestine, which again composes of the different parts, something like that. So these all forms of digestive system, and most of the digestive system, as you know, is forms you can see in the abdominal and the pelvic cavities, actually. Again, present in the abdominal and pelvic cavity, you can have the various excretory and the reproductive system. Excretory systems are mainly concerned with the production of the urine and the filtration of the toxic waste from the body. So the kidneys do that function. And as well as the structures like the ureters and the urinary bladder, they form part of the excretory system. And the reproductive system is formed by the male and the female, the gonads or the internal reproductive organs. So these are all structures which are mainly seen in the abdominal and the pelvic cavities, actually. And again, you might have heard about the endocrine systems, very important, in the production of the hormones, actually, which are very important for the normal functioning of the body. There are different important endocrine organs like the pituitary gland, thyroid, and the hypothalamus and the adrenal glands, etc., which produce the various hormones, which are very important for the normal functioning of the body. And coming to the most important part, that is, of course, the entire coordination of the human body or the various systems is done by the nervous system. Okay. Okay. The nervous system includes, especially the it includes several subdivisions like the central nervous system, the peripheral nervous system, the autonomic nervous system, but mainly the body functions are mainly coordinated by the central nervous system, which includes the brain and the spinal cord. I'm going to just highlight a few important areas which may be of interest to you. I don't know, you might have studied about the heart, the different chambers in the heart. Actually, that may be some technically important for you, as especially important. The chambers like the two atria, the right atrium and the left atrium, and the ventricles, right ventricle, and the left ventricle. Just have a quick recap, something like that. All the impure blood, all the deoxygenated blood from the various parts of the body, they reach the right atrium first, actually, and from the right atrium, the blood passes to the right ventricle. So actually, there's a valve. Actually, there's an orifice, or which is called as the right atrioventricular valve or the tricuspid valve. which transmits the blood from the right atrium to the right ventricle. All the chambers of the heart, they act in a very synchronized manner that forms a part of the cycle, which is called as a cardiac cycle actually. That's related mainly to the function actually. And from the right ventricle, the deoxygenated blood goes to the lungs, because the humans actually the lungs are the sites of oxygenation, where the exchanges between the blood and the air take place at the alveolar level actually. And after the oxygenated blood, after completing oxygenation in the lungs, they return to the left atrium, and from the left atrium they goes to the left ventricle, and from most of the oxygenated blood is pumped to different parts of the body by the major blood vessels starting from the aorta. So this constitutes the different chambers, and there are different valves, there are different orifices which are guarded by the valves, which are very important in the normal performance of the normal functioning of the cardiac cycle actually. And I think this might have heard about, it may be again technically important for you, the conducting system of the heart. I told you the heart is entirely composed of the cardiac muscle, and actually some parts of the cardiac muscle, okay, have got an inherent potential to generate their own impulses. So that forms the conducting system of the heart, because the heart beats of its own actually. So the chief, which is called as the pacemakers of the heart, and you have got the main pacemaker, of course, is the SA node actually, yeah, which is seen somewhere in the upper part of the right atrium actually. Of course, these are not visible to the normal eye actually. Okay, definitely there's not much variation between this and the normal anatomy, of course. And the heart again is again very important from a disease point of view. I think I think one of the most common diseases that affect the present population, especially in a young population, is actually the atherosclerosis, and mainly affecting the coronary arteries actually. So what is called a coronary artery disease, especially, is very rampant throughout the world, and especially in our country also, the coronary arteries. The heart is exclusively supplied by a pair of coronary arteries, the right and left coronary arteries, which supply the blood to the heart. Of course, they take origin from the aorta and supply oxygenated blood to the heart. The heart is entirely dependent. The myocardium. Myocardium means the muscle of the heart is actually entirely dependent upon the coronary arteries, and any occlusion or any blockage of the coronary arteries, and very easy, right from a very young age group, the atherosclerotic or the plaque deposition or the fat deposition occurs in the coronary arteries actually. And right from this thing, okay, can increase the luminal diameter or decrease the lumen of the coronary arteries and affect the blood flow. So definitely that's one of the most important diseases that we are facing right now actually. And this is one of the investigations we performed in a blockage in a patient coming with a coronary artery disease. Probably the first investigation to find out if there is any blockage of the coronary arteries. The most common procedure performed is called as a coronary angiogram. And if we find a block, we go for a further procedure like an angioplasty or stenting, or if the block is a very major one and affecting more than 2 or 3 coronary arteries, we go for a coronary revascularization surgery, what is called a coronary artery bypass surgery. Okay. Respiratory system, already know the lungs are the and the alveoli, in which all the exchange takes place through the alveoli. Okay, and just a few words about the most important the coordinating system of the human body before we go further. The nervous system. The nervous system is mainly constituted by the neurons, which are the cells of the nervous system. The structure of a neuron, I think you may be familiar with the structure of a neuron. We have got the neuronal cell body is the axons, and the dendrites are the okay. And the axons are connected by means of the synapses. Synaptic means the synaptic junctions actually, through which the neurotransmitters, they permit the flow of information from one neuron to another neuron. The synaptic transmission is there. And as I told again, the nervous system mainly consists of the central and the peripheral nervous systems. Both are important in the normal functioning of the body. Just to give you a brief idea, the central nervous system is mainly composed of the brain and the spinal cord, of course, and the peripheral system is mainly composed of the cranial nerves. There are about 12 pairs of nerves actually, which take direct origin from the brain actually. So these are called as the cranial nerves. They supply especially the structures in the head and neck region. And there are some nerves which take origin from the spinal cord. So these are called as the spinal nerves. These are called as spinal nerves or the peripheral nerves because they help to carry the information from the brain to the spinal cord and to the various parts of the body actually. And the neurons or the whatever structure, the neurons can be divided broadly into two types, which are called as you might have heard about the sensory neurons or the motor neurons. The sensory neurons, they take the information from outside the body, like for example, touch, pain, temperature, anything, heat or cold or something like that. And through the spinal cord, they pass it down to the brain for the final recognition and for the final discrimination and determination. Whereas, for example, if you want to move a muscle or do a particular body movement like that, that signals are starting from the brain, some special areas of the brain. They're coming down to the spinal cord, and by the spinal nerves, they reach the various muscles. And they produce a contraction of the muscles. The signals produce contraction of the muscles. So these are called as the motor neurons, which are also called as the effector. The other is called as the effector organ. So there are two types of neurons or two types of nerve fibers. One is the sensory neurons or sensory nerves, which carry the different sensation from the body parts to the brain, to the central nervous system. And the motor neurons, they carry the efferent information to the various muscles for the various body movements or the proximal gland, the hormone, various structures, etc. The spinal cord is a main, because of the positive time, and not be able to go to the details of the spinal cord. The main connection between the brain and the other parts of the body. Whatever information, most of the information that passes from the other parts of the body have to reach the brain, or from the brain have to reach the body. The other parts of the body have to travel definitely through the spinal cord, definitely. And I think just a few words about the most amazing organ probably has God gifted us. That is actually the human brain. Again, which is too extensive to just cover in a few minutes of time, but definitely it's one of can definitely say, and most of you are from the engineering side, definitely. It's much more than an engineering marvel rather than an anatomical distinct. But anatomically, the human brain is not that visually appealing actually, but definitely from a technical point of view, definitely you can say that it is much more an engineering marvel. And it consists of different parts or the different lobes. Like, for example, you can see the cerebrum, which constitutes the major part. Then you have got the cerebellum and the brainstem, which have been assigned specific functions. And any insult or any affect the brain can have various serious consequences that will affect the various body parts actually. The most important part of the brain is, of course, the cerebrum, which constitutes the major part. You can just go through this picture if it is visible for you. It just shows the evolution of the brains for the various animals or the various mammals, including the humans, actually, the human brain. The human brain may not be the largest, actually. Maybe, of course, there are other larger animals which are having much larger brain, actually. But of course, when compared to the animals or something like that, the human brain is very much, you can say, what is called as highly differentiated or well-ordered. The basic structure is, of course, the same, actually. But there are some very, very clear and very demarcating structural differences between the human brain. And even when you examine the closest mammals close to the human, like the gorilla or the chimpanzee or something like that. There are some structural details which are very well appreciated in the human brain, especially. Probably that may give us the higher importance of the important higher functions which are present in a human being, actually. So just to show the brain, the cerebrum, especially, cerebrum consists of the two cerebral hemispheres, actually. The right and left cerebral hemispheres, which are actually united by a bundle of white matter, means that a bundle of axons which are called as the corpus callosum, actually. And this is also important because the cerebrum is divided into different lobes, like the frontal lobe, parietal lobe, temporal lobe, and occipital lobe. And this is very important because it has got specific, it controls specific functions of the body, actually. And this term is also important. Again, I told you there are several body functions like for example, like motor activities or the sensory activities like speech, hearing, audition, like vision. So all these areas, they are well represented in specific parts of the human brain, especially the outermost layer of the cerebrum, which is called as the cerebral cortex, actually. There are very well mapped out topographical areas which are allocated or which are assigned to a specific body function. That's why I said the brain is a architectural marvel, actually. And this controls the particular areas. For example, there's a specific area allotted for the speech. Actually, there are actually 2 areas allotted for speech. There's a particular area allotted for vision. There's a specific area allotted for the motor activities, the movements of the muscles. There's a specific area where all the sensory impulses are received and finally they are perceived actually. So these are called as the functional areas of the cerebrum actually. Actually, the functional, I've told you in the beginning that the brain has already got the 2 lobes actually. The 2 hemispheres are the right and left hemisphere. The functional areas are present in both the hemispheres, but usually there is a term we usually use in medical terms which is called cerebral dominance. One of the hemispheres is slightly more active when compared to the other hemispheres. Usually in right-handed persons, in almost all the right-handed persons, and also in the left-handed persons, some of you may be left-handed actually. It is usually the left cerebral hemisphere that is usually dominant. We call it as the dominant cerebral hemisphere. And the dominant cerebral hemisphere controls the opposite half of the body. For example, if it is the left hemisphere controls all the motor activities, all the sensations, everything on the opposite half of the body. So if anything happens to the left cerebral hemisphere, usually you get some disease or paralysis or some loss of sensory disturbance, something related to the opposite side of the body, for example, the right half, and vice versa. And because in humans, mostly we get called it as a what do you call it as a left cerebral dominance actually. Most of our activities, especially the higher functions like this memory, speech, and everything, they are controlled by the and mathematics. Everything is controlled by the left cerebral hemisphere. So it is called as a dominant. So any diseases or any particular stroke or any conditions that affecting the dominant cerebral hemisphere can have much more devastating consequences when related to the right hemisphere. And probably this highlight, these are some of the special functions which are, okay, I don't know whether these higher functions are present in the other animals or the primates or something like that, but these are very much well differentiated in the humans. The higher functions, what we call as the higher functions. Okay, these are not assigned to a specific area or allotted to a specific area, but these are actually a group of areas in the human brain that perform these functions, or what is called as a higher function. And one of the most examples of a higher function is, of course, your memories actually. The memories, there are several aspects of memory actually. So it's not a single area, there are different areas which are involved in the memory process actually. Okay. So that. Can you just showing some pictures related to higher functions? We have been having a very long section, just last 5 or 10 minutes. Showing some pictures. Can you just guess what is given in that picture actually, or somebody just some higher functions, something like that. This I told you regarding the memory. I think you hope you are in the class. The memory. So I told you it's controlled by the different parts of the human brain, especially the cerebrum. And what is this again?
The expressions of a person.
Expressions, emotions. I think we have different sets of emotions. So again, we have got the different parts of the brain that controlling the various emotions. What is this?
Balance.
Now, balance is that's actually the physical term, but really use that. What is why we call it as a judgment actually. Okay, what is called as a discrimination, to judge between what is right and wrong. What is that? The judgment. So these are all. I'm just showing the slides which are very unique to a human brain. Of course, all the I told you all the functions and everything, like the motor function, sensory function, the speech, everything is present in the other animals also. But some of these functions are much more highly differentiated and much more apparent in human beings. So these we are calling by the higher functions. Okay. Okay. The judgment is the discrimination is the. What is this? I think you may be aware with that. Maybe what is called as maybe decision making. Very good. Decision making. So arrive at the correct decisions of them. These are all performed by exclusively some parts of the human brain actually. Because when we see any psychiatric patients or something like that, or patients with a brain disease or something like that, we look for all these sites. Of course, we look for the muscles and the muscle examination and the motor examination. We also look for this cognitive, what is called the cognitive functions or the higher function. There may have some disturbance related to these functions also, definitely. Okay, what is this?
Matching.
Matching, okay. What is called one decision making or something like that. Okay, good. And your personality, who are you, or your personality is determined by your brain. Okay, good. And again, as you know, most of us are social animals. We interact with others in a group or something like that, definitely. So everything, the social behavior is also determined by your brain. So these are some of the higher functions, especially controlled by one. There's one special area in the front part of your brain, which is called the prefrontal cortex or the prefrontal region, which is one of the highly developed regions in humans actually. And maybe the higher functions or the cognitive functions that have been attributed to humans, maybe because of the presence of this area actually in the prefrontal cortex. Of course, it is outside the scope of this class to tell more about this brain. So we'll be just winding up this thing. Can you just read through what is given, just a small text or something like that. Anyway, I'll give you a few MCQ questions for you answer tomorrow, definitely. This is a visual puzzle or something like that. So just a very basic thing to, okay. I think I have given some words, some colors.
So words with different colors, sir. Blue is
okay.
not.
You just go through that. Okay. Can you just read like that? Because what I have given there, can you read with the colors?
Yes,
the
sir,
color
red.
given to that. So for example, I think blue is given in red.
Red, blue, yellow, green, black, red. Blue, yellow, black, red, green. Again, it's a green, a dark green, and yellow, and green, blue, black, red, and green.
Okay, very good. Okay. So this is just a small exercise for your brain, actually. This actually tests your both. I told you in the beginning that there are the two dominant hemispheres. The right cerebral hemisphere is there. The left cerebral hemisphere is there usually. Usually the dominant hemisphere and the non-dominant hemispheres. So this small exercise just checks the connection. What is the coordination between your the right brain and the left brain, or something like that. The left brain is the dominant brain in most of us actually, and most of the visual attributes like the word term, the words, and actually everything, language is mainly related to the left brain, the dominant brain actually. Whereas the colors, for example, if you tell mathematics or something like that, especially the geometry, arithmetic is a function of the left brain. That's the dominant brain actually. Whereas the geometries mainly, or the three-dimensional or something like that, images, colors, artistic talents, including your song, dance, or something like that, maybe that is related to your non-dominant brain, non-dominant hemisphere. So this is a simple exercise to test between the coordination. How will you you coordinate between the right brain and the left brain or something like that. So the left and the right brains actually, because all the areas, all the functions are present in both the hemispheres. But okay, in humans actually we call it that one of this is okay, and some of the got some specific functions. For example, told you the left brain mainly deals with the language, the numbers, the arithmetic, analytical thinking, the logic, etc. is a part of the left brain. Whereas the right brain is more in expression, emotional intelligence, imagination, the artistic talents, etc. are mainly in the right hemisphere. But of course, for a normal thing, you should have a good coordination between both the right and the left brains actually. And this is also very good. I think we have been running short of this actually towards the end of the session actually. So the brain, actually now brain is composed of the neurons and the neural tissues. They need a constant supply, 24/7 supply of two important structures, the oxygen as well as the glucose. Actually, oxygen is much more important than glucose. I think you might have know that the neurons even cannot survive even for a few seconds without oxygen. And the process of the neurons, they are not do not have the capacity to regenerate. Once the neurons are damaged, that part of is damaged forever actually. So that's the most important part of the other tissues can survive to a certain extent or have the capacity to regeneration, But the neurons, especially the neurons, of course, there are, okay, they can regenerate to a certain extent, but of course, in the brain or something like that, we know that mainly if it gets deprived of its blood supply, that means its oxygen, even for a few seconds of time, it can lead to irreversible death and degeneration of the neurons, and the loss of the functions which have been attributed to a particular organ like that. So that's why the disease of the nervous system are very, very important actually. Okay. So this is just a brief what I call as a bird's eye view of the extensive subject of anatomy, and just touched upon a few interesting areas which may be of importance to you actually. Definitely. Okay. And just 5 minutes, I told you I'm not an expert in medical imaging, but since my lecture composed a common course in medical imaging, I will try to just introduce into the just medical imaging, of course. As you know, a patient going to a doctor with a disease, something like that, about several series of examinations. The doctor is going to examine the patient. First, he takes a history from the patient. That means the history of the disease, symptoms, and signs like that actually. Then he goes for an examination of the patient. Okay, and after that examination, you have to confirm the diagnosis or what particular disease or present is that. So that is being done usually by means of the various investigations, even to the various blood investigations are there, urine, various the body fluids investigations are there. And one of the what you call the cornerstones of investigations is the radiological anatomy. I think now it is very widely used nowadays to arrive at a specific diagnosis. Actually, it is a point where the human anatomy knowledge actually meets right clinical practice, and you will be with a radiological technique. I think is so advanced like that. I think most of you, I think from the electronic side, may be more familiar with the latest radiographic techniques rather than me actually. Okay. So I think it was almost in the 1895 actually that William Röntgen discovered the X-rays, and you know the special properties of the X-rays, something like that, how it penetrates the body. And actually William Röntgen put the first X-ray of his wife's hand actually. Okay, so that is thing like it. And depends on the atomic density. Some of the body tissue there absorb X-rays, and some do not absorb X-rays. Something that depends. And the various images you can can be visualized on an X-ray screen or an X-ray film. So you can get an X-ray images or something like that. Especially X-rays are best used to visualize hard bony structures, which absorb most of the X-rays. And you see that what is called as a radio opacity or something like that. Used to visualize hard bony structures like the bone and the teeth actually. They are very well visualized, even for a fracture or a dislocation, something like that. Any diseases related to bone. Even we go for a basic X-ray first as the first line of investigation actually. Okay. But of course, there are several risks like higher electromagnetic radiation risk is there definitely. Don't advise pregnant ladies or the younger age group children to undergo X-ray at this stage. But definitely. But of course, if definitely needed, we'll at least go for X-ray. But as far as possible, try to reduce the frequency of the X-ray. X-rays are low source of radiation, and I think most of the benefits they outweigh the risks of the X-rays. And in spite of the various things, X-rays still continue as the workforce on medical imaging actually. And there are various other modern medical techniques. I just give you a brief idea before I wind up actually. Most of the data, it may be related to X-rays or other radiomagnetic spectrum with a base or something like that. They produce data that is integrated and analyzed by computers, and which you be X-rays are mainly a two-dimensional image. But most of the modern medical imaging techniques, they create a three-dimensional images that reveal specific aspects of the body functioning also actually. This thing again. You might have heard of a computer tomography or a CT scan. It's actually very non-invasive, and here you use several cross-sectional X-rays or analyze to reveal the minute details of the various body parts actually. Okay. So if you want to study any particular tissue or organ detail, like for example, the brain or the bones or something like that, you go for a CT scans actually. This thing and like it. And I think it is I'm not going to the procedure actually. The CT scanner rotates 3 degrees, 60 degrees around the patient, taking X-ray images and combined into a two-dimensional view of the scanned area. Usually the body is examined in slices or a scanned area of a particular millimeter thickness or something like that. Now you get a two-dimensional view of that particular high what is called a higher resolution image of that particular area, actually. This is especially for soft tissue scanning. So the problem with the X-rays is that the soft tissues, like the many of the organs, are not visible on an X-ray usually. So especially for a sort of for a lungs or a heart or something like that, especially for a abdominal viscera or the gastrointestinal system, we go for a CT scan. The level of detail is so precise that is possible to measure the size even down to a millimeter in thickness actually. So it's a highly effective nowadays actually, the CT scan. Okay. But again, there's a problem with the radiation, that the dose of radiation, the use X-rays and the dose of radiation may be many times higher than that of X-rays actually. But definitely the advantages outweigh the risk actually. Again, magnetic resonance imaging is now done very commonly nowadays. It's non-invasive actually. And the matter, whatever is exposed to the magnetic fields and the radio waves, actually, there's a combination of these two actually, and the radio signals are emitted actually. The MRI was discovered this particular physicist Raymond Dept, okay, in the 70s. The early MRI scanners were actually crude, and now the advances in digital computing and electronics has now led to the precise imaging, especially to discover soft tissue tumors, especially. And the advantage of MRI is that they are not exposing the patients to the radiation. Okay. But most of the MRI is so advanced now. It's a much higher cost now, and it causes some kind of patient discomfort. And most of the devices are very noisy. And such a patient is a very powerful electromagnet, so it's somewhat a noisy environment actually, somewhat disturbing to the patient when compared to the X-rays or the CT scans or something like that. Okay, and the most advanced version of an MRI is what is available, and it's called as a functional MRI. You have seen the brain actually. Now it is possible by using this technique to detect the blood flow in certain parts of the human body, like especially the brain, especially. So when you perform a specific body movement, or you speak or hear or visualize something like that, as the functional MRI of specific parts of the brain are taken, and it gives a functional idea regarding the activities going on, depending on the blood flow, the activities going in the different parts of the brain. So this is one of the investigations we use to study the functions of the brain that we have been doing. This is several imaging of the brain using a functional MRI scan actually. Okay. And again, one of the most recent additions about the PET scan, the positron emission topography using the radio pharmaceuticals. Again, I think it's now very much common, especially in the screening and the investigation of especially some tumors or the cancers actually. It can also illustrate physiological activity, including the nutrient metabolism and the blood flow, especially for the cancerous cells actually. It's very much used in heart disease, spread of cancer, especially to find out the spread of cancer, certain forms of infection, brain abnormalities, bone, and the thyroid diseases. Okay, good. And now coming down to a very common basic investigations actually, which uses high frequency sound waves as ultrasonography, in which an echo signal is created and converted into a real-time image of anatomy and the physiology. One of the most commonly used, other than the X-rays. X-rays are not usually now that common nowadays actually, now, but ultrasonography is very, very common because it is the least invasive of all imaging techniques. And it can be very safely used in very sensitive situations like pregnancy, to know the what is called the normal development of the baby or something like that. Definitely ultrasonography, it's widely used because it is considered as very safe and the least invasive actually. And you can also use the ultrasonography to know the heart function, blood flow, like especially, but mainly I think nowadays it is mainly used to study the fetal growth and the development. The image quality is operator dependent, but it is unable to penetrate the bone and the gas or something like that. But it's one of the, but just given a brief idea about the basic imaging, medical imaging techniques actually. Definitely, I think, and I think we are coming to the end of the session actually. So just again, I got to attend one more meeting actually. So we can just have a few minutes for any quick questions actually.
Pranam sir. Pranam sir. Sir, actually, during this adolescence period,
yes,
there is a practical changes in the
Yes.
behaviors of.
Okay.
I want to know what are the internal organizational changes that are occurring during that stage, and what is the
okay? That is during the adolescence. During the adolescence,
Yes.
that is usually okay. That is mainly actually that is being signaled by the I told you the endocrine system is there. Mainly the hormones is there. The hormones, especially hormones produced by the various glands, like the especially you can see the major two glands which are seen in the brain. They are the pituitary glands and the hypothalamus is there. Okay, because the hormones they are called as the master glands because the hormones secreted by they control even the other endocrine organs and the body parts. Okay, so as a child or a person actually passes from the childhood or the puberty or the adolescence, actually there are some changes occurring to this hormones level. Some of the hormones are produced, some of the organs are suppressed or something like that. And these hormones are going to produce the specific structural changes related to the various organs, especially the reproductive organs, especially both in a male and in a female. So it's actually everything is dependent upon okay, there's a specific, right? As you pass from the childhood or the different stages of the puberty or the adolescence, you can see the various changes which are taking place, both the external and the internal changes. External changes are there, of course, but there are also internal changes, especially concerning to the what you call as the gametogenesis, starts at puberty, or something like that. Of course, that definitely is there. So everything is dependent upon the hormones actually. So they control all the processes, all the internal processes. They are under the organs and everything. They differentiate, they undergo further development because they may not be developed. The internal, for example, the reproductive organs or genital organs may not be well developed in a child actually. But as he or she has advances to the puberty or adolescence, something like that, there occurs a very rapid growth of the particular internal organs, for example, like the uterus or the ovaries or something like that. And their function also, differentiation, structural differentiation also occurs like that. That's mainly dependent on the hormones which are produced by the endocrine glands, especially the two endocrine glands, especially the hypothalamus gland and the pituitary, which are seen inside the brain actually.
Sir,
excuse me,
actually,
sir.
okay. So the behaviors of the adolescent stage people, how can we able to make a control over them? Because we are dealing with, we are traveling with the students in that stage.
Okay. You mean the behavioral aspects?
Yes, sir.
Behavioral aspects also. I told you, it's a behavior is mainly a function of the human brain actually. I told you there are several aspects what is called a higher function. Okay, you can attribute behavior also can be taken as a part of the one of the functions of the human brains actually. A thing like it. But there are several factors. Of course, human brain, when the function is there, of course, even there were several okay, you can say the hormones are there, but even the brain function more important than the hormones. You might have read about the neurotransmitters are there. There are various neurotransmitters, very important in the normal functioning of the brain, like which act at the synapses like that. There are several hundreds of neurotransmitters which have been identified. And all of these neurotransmitters have got some specific roles assigned to the brain function. For example, like behavior, memory, or something like that. For example, some diseases, one neurotransmitter, for example, if they're deficient or something like that, they may relate to a particular condition. So you have to give the drug in the form of a drug or something like that in that form. So that's also related to the neurotransmitters. That is okay. Maybe related to the endocrine system, but I think the behavioral aspects is mainly again, it's actually it can be linked to the brain actually. This thing, like especially as you said, in the adolescent or the puberty age group, of course, there of course all the entire body, of course, including the brain, everything undergoes what you say is a series of events or changes are taking place. Not only in the external reproductive organs or the external aspects of the body, even these changes are taking place in the brain also. So there can be some variations in the levels of this neurotransmitters or something like that. Of course, there's a balance between all these functions. There are okay. Some are very what you call excitatory neurotransmitters. Some are inhibitory neurotransmitters. So actually, but we think that for normal brain function or a normal behavior or something like that, there should be a proper balance between these two actually. But of course, you cannot say that. Of course, that forms most of the psychiatric disorders everything. It starts from like stress or anxiety or any behavioral disorders. All this can be traced back to the origin on in the brain or in the neurotransmitters. Of course, there is nothing wrong with the structure actually, but something wrong with the normal neurotransmitter or the normal function that can affect a specific parts of the brain. So that can lead to, as you said, that can lead to some behavior disorders or something like that. But it is very difficult to tell like that. Definitely, it needs a lot of because most of this we cannot find out any imaging techniques or something like that. But we use a different kinds of techniques to find out the behavioral techniques like that. I hope I may be able to answer your questions, sir. Definitely.
Okay, sir. Thank you, sir. Thank you, sir. Thank you very much, sir.
Sir,
Anything? Yes, please.
sir, what is the reason for skull vault osteoma occurs?
Can you just repeat that question once again, sir?
What is the reason for skull osteoma occurs?
Skull osteoma.
Yeah.
Osteoma is actually is a tumor. Actually, tumor is a growth. Actually, as you know, any cancer is called as a tumor. So osteoma, osteocytes. I told you, osteocytes are the normal cells which are present in the bone. Actually, so usually there's a specific time the bone cells are there. Of course, the cell, but there's an abnormal multiplication of the abnormal replication of the bone cells. We call, okay, of course, any cells, not only the bone, any cells, an abnormal replication usually is we call it as a precancerous stage or a cancer stage or a tumor. Tumor is an abnormal replication or abnormal growth of normal cells actually in any region of the body. For example, if that particular situation occurs in any bone, actually, the bone cells are there. So in any part of the bone or something like that, bones are present in the okay, you can see the bones in different parts of the body, including the skull actually. So if there is any multiplication, abnormal multiplication of the bone cells in any particular region of the bone of the body, that can create a condition which is called an osteoma. Again, it can be a benign. Benign means it can be a harmless condition, or it can be even it can be a precancerous condition, or it can proceed to cancer, or depending. We cannot say it at the presently, but depending on that, osteoma just means it's an abnormal tumor occurring from the bone tissues, bone cells actually.
So it is non-cancerous, sir?
That we have to see. We have to do some special investigations to find out. Usually osteoma, maybe osteomas can be both. It can be both cancerous, or it can be benign lesions. But again, we have to do for a what is called for we got for a histopathological examination. That I have to told you something about. We have to take a section of that particular bone or something like that and study under the microscope. A pathologist will be able to tell. Of course, there are some peculiar signs or peculiar telltale signs of a cancerous tissue, like abnormal multiplication, presence of something like that. So definitely a pathologist will taking a tissue, doing a microscopic examination, will be able to tell whether it is likely to be cancerous or not like that. But according to my knowledge, I think most of the osteomas, I think usually they are benign tumors, harmless tumors when compared to the other cancers. But of course, it is an abnormal multiplication, it's an abnormality. It's a multiplication of the abnormal multiplication of the bone cells actually. So definitely, but you need further investigations to find out whether it is cancerous or not actually. So definitely.
Okay, sir. Thank you.
I think we're getting too much questions. You are most welcome. Please, you can just answer a queries if time permits. Definitely.
Sir, please tell me. We take medicine for dilating blood vessels. Are there any natural remedies like, for example, exercise or food for dilating these blood vessels?
Pardon, for which condition, sir? Which
sir,
disease?
many times, for example, when the blood vessels get constricted, blood flow becomes difficult.
Yes,
in that situation.
Okay. Okay.
So in that
there are, for example, it can take place any blood vessels. You can blood vessels actually the blood vessels. I told you blood vessels actually the walls of the blood vessels are made up of muscle and the tissues is there. So anything that it can get thickened or it can get any. Usually, it's a very common blood vessels are a very common site for what is called atherosclerosis. You might have heard it, the cholesterols, whatever whatever we eat in the diet or something like that, cholesterol, the lipids or whatever may get, they have got a propensity to get deposited in the walls of the blood vessels, especially the coronary arteries, especially the arteries supplying the heart, especially. And they can, as you said, they can lead to narrowing of the arteries. So it's that. I think that your question is related to that.
Yes, sir. Yes, sir. Yes, sir.
Yes. So the narrowing of the arteries, of course, usually, of course, I think there are some medicines, of course, to actually to dissolve this flow. Actually, it can happen so much. Varieties are there. It can be a lipid, even blood clots can occur in this thing that can create a luminal narrowing of a blood vessel or something like that. So if it is a blood clot, there are some antifibrinotic agents and so there are some drugs which can dissolve the blood clots and help to increase the diameter of that particular blood vessel. Or if it is it's a atherosclerosis, you can have some medications to actually or to reduce this thing in the leg to reduce the atherosclerotic plaque or something like that, block and restore the blood flow, something like that. But I don't know exactly what are the efficacy of the various natural methods. Of course, there will be several methods are there. But of course, as far as modern medicine is concerned, there are drugs actually which have been undergone trial on something like that, which have been found to be useful and beneficial in enlarging the arteries. But everything, if it comes to the coronary arteries, everything is, I think the drugs have got a very limited role, because any narrowing for more than 40 or 50% of the coronary arteries definitely can lead to a serious cut down of oxygen and to the heart muscle actually, and can lead to the defective functioning of the heart. So that's very important as far as the arteries, the coronary arteries are mentioned. You have to go for a surgical procedure at the earliest, like a coronary angioplasty or stenting, something like that. For the other blood vessels or something like any other blood vessels are affected, again you can go for a medication or something like that.
Yes, sir. Thank you, sir. Thank you.
Sir, one more question, sir.
Oh, sure, no problem.
Sir, can you please suggest some brain exercises to improve our memory skills, sir?
Okay, because I've been doing some research in the brain because of it. So my busy schedule, I'm not to be able to this thing and the like it. So whatever we have learned is that one of my professors used to say is that you put the brain to maximum use. That's the best thing. That's the maximum. You just like you exercise, go to a gym or something like that. Definitely, you put your brain to maximum stress. The brain will be able to do, because I think you might have heard that we are just using only a very little fraction of the capacity of the human brain, which is capable of actually this thing in the leg. We are utilizing only very narrow part of the brain actually, as far as the functional capacity is concerned actually, if in our normal day-to-day activities. So whatever you asked is a very, very pertinent question. So what I say that you put maximum stress, just like you exercise or just like to exercise the other body parts, the best exercise to give work to the brain actually. Maybe okay, and definitely the brain exercises. Of course, we don't usually advise the brain exercise for the normal people, definitely, but definitely for a patient who are with the dementia disorders or related to the dementia or the memory, we usually go for because actually, strictly speaking, there are no drugs or medicines to improve the brain function, because there will be commercial, so many preparations will be there definitely. But of course, I can say definitely that none of it is going to use they are going to increase the brain power or your IQ or your brain function or something like that. It is already that, because most of the brain is formed on most of the neurons. There are about 2 billion neurons in the human brain. Most of these neurons are formed at the time of your birth itself, actually. So after that, there is no fresh generation of the neurons, definitely. And only there's a destruction of the existing neurons out there. But of course, there are several techniques like meditation, yoga. We don't know, but several techniques have been. I think worldwide, I think the most of you can say almost 80 to 90% of the medical research is oriented on the human brain to function, to find out what affects the human brain, what can improve the the brain function or something like that, the cognitive behavior or something like that, definitely. But presently we are not very sure what kind of exercise will suit the brain. So whatever our daily activities, whatever we put the brain to the maximum use, something like that, definitely it is going to, definitely the brain is going to respond in the in the same way. And of course, as we told, that the relaxation techniques, yoga, and everything, meditation, everything, they have all proven they have got they can improve the brain function to a certain extent.
Okay, sir. Thank you so much, sir. So, like, on behalf of the Department of Electronics and Communication Engineering of Nehru College of Engineering and Research Center, I would like to extend my heartfelt gratitude to Dr. Ramakrishnan for accepting our invitation. Thank you so much, sir, for your informative session. Thanks a lot.
Okay, thank you, Dr. Mridula and Dr. Kirtana once again for giving this opportunity. But because, okay, I've been used to take classes for medical students and the doctors and everything, but because it's this thing, I love taking classes for a very heterogeneous population like that. So definitely, it's a this thing. That's why I think I made my topic very as simple and as to you actually understanding to you actually definitely. But this is a very vast topic actually. So please feel free. I am a part of your institution. Please feel free to get in touch with any queries or any further concern. Definitely, I will be most welcome to accept any such thing. So once again, thank you very much for giving this opportunity for
yes,
the presentation.
sir. Mridula here. Mridula here. Thank you.